Bones play a critical role throughout our body, so it's important to keep them healthy. And joining us with some simple and easy ways to promote bone health is Dr. William Junius this morning. It is something we don't think about, keeping your bones healthy.
That's right. Most people think about exercise in terms of their muscles, which is very important also, but exercise actually increases bone density, which can prevent fractures.
So I mean, is this a case of Mom always said vitamin D, but that's not just Mom talking, the vitamins are a critical part of that?
So certainly parts of your diet are important for bone health, vitamin D and calcium being the two most important. Your body's actually sort of solar powered, so vitamin D actually gets made through your skin by exposure to sunlight.
All right, so and you're better off eating like green leafy things or can you just say, oh, let me go out and pop some vitamins?
So probably the best thing to do is a good balanced diet, but I do have patients that I recommend supplementation to.
All right, so I think, Doctor, the thing about all of these warnings that we get from time to time is the incentive for not ignoring them is what? I mean, what are the consequences if you don't take care of your bones?
Well, the things that I see in my practice are patients who develop fractures, and especially if they're not very active and have good muscle quality, they have a very difficult time returning to activities during the healing process.
And then I guess it's always a function, too, of your 35-year-old self needs to listen to your 75-year-old self.
That's true.
Which we don't do.
Well, a lot of patients ask me, what can I do, what can I do? And I'm fairly hands-off, and I usually tell them, listen to your body. That's more important than listening to me.
Is it something as simple as, bicycle riding, or, what do you, just walking? What do you, obviously going to the gym has probably the highest benefit, but if I'm trying to exercise the skeleton, basically.
Right, so weight-bearing exercises are the most important. So the opposite of that would be like swimming in a pool. Great exercise, but it's not as good for bone health as walking or doing a moderate weight exercise routine.
How do you know if you've got an issue?
So you don't know. The only way, there's no usual symptoms of osteoporosis or poor bone health. The only way to really know it is to get screened for it, and that's a bone density test.
Which you can do with your doctor. And I mean, should you do that at age 35, at age 55?
It depends. It depends on the type of medical conditions that you may have. So some people who are taking particular medications may do that sooner, but in general, most patients do that around the age of 60 or 65.
Right. And is this something that's happening with your doctor's going to say, hey, it's time, or do you need to go to a doctor and say, hey, I need a bone checkup?
So usually your internist will look at that and kind of like a checklist, say, you're at this age, you need a colonoscopy and you need a bone density test.
Okay, gotcha. Work on the muscles and don't forget the foundation, I guess.
Correct.
All right, Dr. William Junius, appreciate the time this morning.